Viewed from behind, the spine should appear to be perfectly straight from top to bottom. Scoliosis is a condition where the spine has an abnormal side-to-side curve. As you grow, the curve can become worse. If it becomes severe, it can affect your posture, walking, and cause back pain. It can also reduce the space available for your internal organs, causing heart, breathing, and digestive system problems. Most people with scoliosis do not need surgery. It can be managed with a brace to stop the curve getting worse. Despite this, if regular X-rays show the curve is worsening, then spinal fusion surgery should be considered. You're watching this video because a surgeon has recommended you have posterior spinal fusion for scoliosis. This means straightening the spine and permanently joining the spinal bones. Here, we show the surgery on a young man, but it's usually done on teenagers or young adults while the bones are still flexible. After being put to sleep, you'll be placed face down on a special soft mattress. An incision or cut is made in the middle of your back. Its length will depend on your personal requirements. The muscles and tissues are parted to reveal the bones of the spine. X-rays are used to guide the surgeon throughout the operation. They will roughen the surface of the bone to encourage it to fuse. Screws, rods, hooks, or wires may be inserted to form an internal scaffold. The spine will be gently pulled into a straighter position by these strong rods. Depending on how flexible your spine is, it may not always be possible to make the spine completely straight. The number and location of the metal implants will vary depending on your personal circumstances. Next, some bone graft will be taken from the back of the hip and placed along the whole length of the spine to encourage the spinal bones to fuse. Over the next 1 to 2 years, the bony bridge becomes solid and the spinal bones will fuse to become one single bone. The metalwork becomes part of you and is not usually removed. The skin will be closed with sutures or skin clips. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you've understood everything.